let's talk about your mind. Think of it as the most powerful computer you'll ever own. But, sometimes the software gets a little buggy. We get stuck in these loops of worry or habits that just don't help us. So today, we're going to learn how to debug that code using a really powerful framework. And it all really boils down to this one huge question. Can you actually change your life, your habits, your happiness, the whole shebang, just by changing the way you think? The answer is a huge, resounding yes. And we're about to dive into exactly how. The main tool we're talking about is the Cognitive Behavioral Frame of Reference, or CBT-FOR for short. Now, this isn't just some feel-good idea. It is one of the most evidence-based psychological approaches out there. And the core concept? It's simple, but so profound. Our thoughts, our feelings, what our body is doing, and our actions, they aren't separate islands. They are all part of one deeply connected system. So here's our game plan for this explainer. First, we're going to really understand that connected system. Then, we'll take a journey inward to look at the different layers of our minds. After that, we'll come back out armed with some awesome practical tools for both your thoughts and your body. And finally, we'll look at the unique role occupational therapy plays in all of this. Sound good? Let's jump in. Okay, first up, learning to see your own experience as this totally interconnected web. So this visualizes the heart of CBT-FOR perfectly. Imagine you're at work. That's the environment. And a thought pops into your head. I'm totally going to bomb this presentation. That thought immediately triggers an emotion, maybe anxiety. Then your body kicks in with a physiological response. Your heart starts racing. And all of that leads to a behavior, like you start avoiding practicing your slides. You see how it works? They're all linked. A change in one piece creates this ripple effect through everything else. And this is so important. The goal here isn't to rely on someone else forever. It's all about learning these strategies so you can become your own sort of mental architect. You learn to spot and replace those unhelpful thoughts with stronger, more adaptive ones. It empowers you to build healthier behaviors that you can use on your own, anytime, anywhere. Okay, let's take that journey inward. To really get a handle on our thoughts, we have to understand that they're not all the same. They exist on different levels. And we're going to use psychologist Aaron Beck's hierarchy of cognition to help us peel back those layers. This pyramid shows it so well. Right at the top, the surface level, you have automatic thoughts. This is that immediate chatter in your head, like, oh, I messed that up. But if you dig a little deeper, you find your beliefs. These are kind of like your personal if-then rules. If I make a mistake, then people will think I'm useless. And then at the very bottom, the foundation of it all is your core schema. These are the deep, absolute truths we hold about ourselves, like, I am useless. This is the deepest layer, and as you can imagine, the most challenging one to change. All right, so we've journeyed inward. Now it's time for the journey back out. But this time, we're armed with tools to actively challenge those thought patterns. This is where we get into the really practical stuff, cognitive restructuring. And here are just a few really powerful examples. Journaling something called Credit Daily forces you to focus on what you accomplished, not just the negatives. An outcomes tracking worksheet is cool. It lets you see how often the things you worry about, don't actually happen. And just learning to identify these unhelpful thought patterns, like thinking in black and white terms or predicting the future, is like learning to spot the glitches in your own mental code. I absolutely love this tool because it's so direct. It basically turns you into a detective for your own mind. You take an unhelpful belief, let's say I'm bad at making new friends, and you put it on trial. On one side, you list all the evidence for that thought. On the other, you list all the evidence against it. It forces you to be objective instead of just running with a negative feeling. And hey, if you need just one thing to grab onto for those tough, in-the-moment situations, it's this question. When that negative thought pops up, just pause and ask yourself, okay, but what is the actual evidence that this is true? Seriously, that simple question can be enough to break the whole cycle. So, we have tools for our thoughts. But remember that connected system we talked about? It's not just in our heads. We also need tools that work on our behaviors and our bodies to help us manage our emotions and those physical reactions. These techniques give you concrete physical things to do. Deep breathing exercises, they can literally calm your nervous system in minutes. A worry jar, where you physically write down a worry and put it in a jar, helps get it out of your head. Role-playing a tough conversation builds real confidence for when it actually happens. See, these aren't just about thinking differently, they're about doing differently so you can feel differently. So, who helps people put all these strategies into practice in the real world? Well, let's talk about the unique and really vital role that occupational therapy plays in applying all this. This is a really important distinction to make. You might be thinking, isn't this just talk therapy? Well, not exactly. While talk therapy focuses on discussing challenges, occupational therapy, using the CBT-4, is specifically brought in when a person's mental health is creating a real barrier to their daily life activities, what OTs call occupations. We're talking about things like sleep, work, socializing, or even just getting groceries. OT steps in when the thought patterns are actively getting in the way of living. And it's so important to know that occupational therapists who have the proper training are absolutely qualified to implement these powerful CBT techniques. They use them within their scope of practice to help people perform better and find more satisfaction in the activities that give their life meaning. So we've gone from the big picture theory down into the layers of the mind and come back out with a whole toolkit for change, which brings it all back to you. We'll end with a challenge. Using what you've learned here, what is just one unhelpful thought that you could put on trial today?